Hi, I'm Cheryl and I'm an Information Officer here at Contact Family. If you're a parent or a carer of a child with a disability or additional needs, you may find you want to do your own research on their condition and how it will affect them. Most parents or carers turn to the internet as their first port of call, and it's quite difficult to try and find reliable medical information. My job here at Contact Family is to keep our medical information up to date and also to help people within the organisation and the public find reliable medical information. I'm here today to talk about some of the things you might come across and answer typical questions parents would ask when looking for reliable medical information on the internet. When you first come across medical information on the internet, it's important to think about who the information is aimed at and how useful it will be for you. Information can be aimed at academics or medical professionals like doctors, or parents and carers like yourselves. If you're looking at information which is designed for doctors, the language may be really complex and it can be confusing. It's important to check that the information that you're looking at is from a reputable organisation. There's a few simple checks you can do to ensure this. Look for the name of the organisation, their address and contact details. If it's a charity, they'll have a registered charity number. Also, think about the aims and the purposes of the website. If it's a company's website, they may be trying to encourage you to buy their products. Also, you need to check how the medical information is verified. Some organisations have a group of doctors who will check everything to make sure it's accurate. Lastly, some sites do have people's personal experiences on there. Sometimes it's nice to have a look at these, but that situation may not apply to your child. It's important to check the name, the position and the place that the author works, and also their qualifications. Usually, information is written by doctors or consultants who work in hospitals and see patients every day. It's also important to check the date the information was last reviewed by the expert. Information which is over a few years old might not be reliable. It's important to remember a couple of final points. Firstly, conditions affect children in very different ways. The information you're looking at might reflect the worst case scenario and may not apply to your child. And secondly, always discuss the information you find with your doctor. They'll be able to tell you how that applies to your child. If you need more help with finding reliable medical information, do give Contact Family's free phone helpline a call. Also at Contact Family, we produce the medical directory. It has over 430 medical conditions described. Each condition entry is reviewed by a medical expert, and we also give details of support groups for that condition. You can go onto our website and click on the medical information section to see the directory entries. You may find it helpful to talk to other parents that are in a similar situation to you. You can do this by joining a local support group and meeting up with other parents, or you can use web-based linking schemes. Here at Contact Family, we run our own website which links families, and it's called Making Contact. Why don't you give it a try?